Hi, you guys. Welcome back for our daily practice questions. It is day 194 and our Pharm series continues. But as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos that I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit that subscribe button so you're not missing any of my videos. And if you would like to gain access to my MP Test Success Toolkit, it is free and linked in the description. Also, my website is linked in the description and it houses everything that I offer. Also, if you're looking to join the upcoming 5-week FMP and AGMP intensive review, the early bird enrollment discount of $100 ends on tomorrow at 11:59 Eastern Standard Time. So if you're looking to join with the discount, make sure you're clicking the link in the description. Class is from August the 11th through September the 12th. All right, you guys, question number one. A 3-month-old infant presents with frequent spit up after feeds, but is gaining weight and appears happy. What is the best initial management? Is it A, start ranitidine? Is it B, prescribe omeprazole? Is it C, reassurance and feeding changes? Or is it D, order abdominal ultrasound? Take a moment and tell me what you got in the comments, you guys. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. Here, the stem of the question states, what is the best initial management? So we're still talking about a treatment, and it's asking about initial treatment. Don't let, a change of word take you out of the flow of what I tell y'all. If they're looking for a treatment, look to see if they provided you with a diagnosis. And so in this scenario, a diagnosis has not been provided. So what do? We got to run it back a step further and look at the assessment findings, right? Because we got to be able to determine what it is to know how to treat it. So we're going to walk through our assessment findings. We have a 3-month-old infant who's come in with frequent spit up after feeds, but is gaining weight and appears happy. So this is classic presentation for GERD. Now, GERD in babies, infants, we are as an initial management option. The best choice is going to be C. You're going to reassure and do feeding changes. And so what that means, think of anything. When it's early on, we do lifestyle modifications. The baby is gaining weight as normal. The baby is happy. Now, if the baby wasn't gaining weight, fussy all the time, then you would consider implementing medications because it's more severe, right? But in these stages, what you would do is focus on like positioning the baby, focusing on smaller and more frequent meals. Same thing we do for adults. And then, positioning them to be upright for a longer period of time after they eat, so to speak. So just trying to do those things, reassuring and making those feeding adjustments to see if that improves for the child since it's such a small baby. Question number two, a 4-week-old male presents with projectile non-bilious vomiting after every feed. On exam, a small olive-shaped mass is felt in the right upper quadrant. What is the next best step? Is it A, prescribe omeprazole and recheck in a week? Is it B, order an abdominal x-ray? Is it C, refer for abdominal ultrasound and surgical eval? Or is it D, recommend hypoallergenic formula trial? Take a moment to tell me what you got, y'all. All right, stem of the question here says, what is the next best step? So let's see what's going on. We have a 4 week old male who's come in. The baby has projectile non-bilious vomiting after every feed. But the classic presentation and the key identifier is on exam, a small olive shaped mass is felt in the right upper quadrant. You know my saying, when I say this, you say that. When I say an olive shaped mass, you say pyloric stenosis, right? And so, especially in this right upper quadrant, associated with projectile vomiting, we're talking about a little baby. These are all of the classic presentations, right? So, your best thing you want to do for for pyloric stenosis is C. You want to refer them so they can get that abdominal ultrasound and get them through the process, because the next steps is surgical management, right? So, C, refer out for that abdominal ultrasound and surgical eval. All right, lastly, question number 3. A 1-year-old presents with intermittent crying, drawing legs up, and current jelly stools. What is the appropriate next step for the nurse practitioner? Is it A, prescribe antidiarrheals and observe? Is it B, start antibiotics and follow up in 48 hours? Is it C, refer to the ED for abdominal ultrasound and air enema reduction? Or is it D, order stool studies for parasites? Take a moment and tell me what you got. All right. Stem of the question. What is the appropriate next step for the nurse practitioner? All right, so what are we doing? What are we talking about, right? So we have a 1-year-old comes in. They have intermittent crying, drawing legs up, and current jelly stools. When I say this, you say that. Those current jelly stools are what? When you think of that, you should say intussusception. Intussusception. I always jack that word up. But knowing intussusception is the diagnosis, then your answer is C, because again, you want to refer them out. This is not something we manage in office. So refer to the ER for abdominal ultrasound and for further management and treatment, right? And typically they do like an air enema reduction, but just know we're referring out. They'll evaluate and treat from there. All right, you guys. The key thing that I was trying to help y'all identify when you're thinking of treatment in these areas, because I often tell y'all know my motto, to go through assessment, diagnosis, evaluation, and treatment. So I want you to be sure, even in these things that we don't actually treat in practice, that you know that even when you're studying it, one, what is the key identifier to confirm a diagnosis of this? And then what do you do in that situation if it's not something we treat in practice? Making sure that you are honing in on those refer, because if you sit and just do the steps that you know that may have been done, or you may have an acute care background and you're going through the steps, you're going to get those questions incorrect. So I'm trying to force you to walk through those steps and say it and retain it so that you can confidently answer questions like this. So that's why I did a lot of those referral style questions on these, to help you tie that together for the treatment in these GI conditions in pediatrics. Okay. But again, as always, I hope you found this helpful. Be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, as always, feel free to reach out to the nursing studio. You can give us a call, shoot us a text message to this number, or shoot us an email to the nursing studio, the number 1 at gmail.com. Everything that I offer is linked in the bio of this channel, including my website. And as I said before, earlier in the video, my website is also linked in the description of this video, and that houses everything that I offer. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.